We're going to roll right into our next segment. In this segment, watch our industry experts discuss the significance of data management in the healthcare sector. We will now invite our moderator up to the stage, William Barber. Please come on up. If I can also please have our panel of experts for this round. Please give it up for Mindy Deschner, AlexDavros, Michael O'Donnell, and Nicholas Caruthers. Coming up, guys.
Well, welcome everybody. Glad to see you this morning. I want to thank you all for joining us today. My name is William Barber, and I'm the founder and CFO of ETROS Management Firm. ETROS is an asset management firm specializing in senior housing. We were founded in New York in 2017, and we currently operate nationwide with offices on both East and West Coast. We currently manage over $300 million in assets across 10 states. Our clients include private equity firms, REITs, and private ownership groups. I'm excited to lead this session with you today to discuss the importance of data management in the healthcare sector. I have an extraordinary group of professionals with me today who are going to share the good, the bad, and the ugly about their experience with data management. As well as we all know, it is now the year 2019, and we now have a vast array of techniques and software at our fingertips to collect data. I am personally bombarded with data every day and must decipher what information is most important to the success of my firm and respond to that data appropriately. Managing the wealth of available data allows health systems to create personalized treatments, improve communication, and enhance health outcomes. Let's take some time to introduce our panel and find out a little bit about their journey and what brought them here today. First, we have Alex. He is the CEO of Embark Behavioral Health in Arizona.
Hello. Yep. Hi, I'm AlexDavros, the CEO of Embark Behavioral Health. We just got done talking about the mental health issues we're having in our country. In 2017, the CDC came out and reported that adolescent anxiety, depression, and suicide reached an all-time high. All numbers are showing that 18 is going to be worse and 19 even worse. So as a group of programs, we're one of the leading, largest family behavioral healthcare companies in the country. And as a group of programs across the country, we set out to embark on what we call our BHAG, an acronym which is BEHAG, Big Empathetic Hairy Audacious Goal. And that's to, off the heels of these high statistics, we want to reverse those trends so that within 10 years, by 2028, anxiety, depression, and suicide amongst adolescents are at an all-time low. And that's our big empathetic, hairy, audacious goal, and hope that all of you can join us on that.
Thank you. Next, we have Michael, who is the CEO of Healthy Nation out of New York.
Thank you. So Healthy Nation is a health media company. We produce health videos, health, food, fitness videos for consumers. We've been doing it for about 10 years. We're venture capital backed. We have an interesting approach in that we're focusing on consumers, but our revenue comes primarily from pharma advertisers. So I think one of the things that's most interesting with sort of hyper-targeting of therapies, it's not just therapies for cancer, but metastatic breast cancer, or not just arthritis, but psoriatic arthritis. And so data definitely comes in play, and privacy is probably even a bigger issue.
And next we have Dr. Nick. He is the owner and CEO of Integrative Wellness Group out in New Jersey.
Thank you. As you saw yesterday, I co-own Integrative Wellness Group with my beautiful wife. The question I asked earlier about how do we get all the different types of specialists to come together to actually fully help heal someone, is because we haven't found that. And that was our process of actually opening up and creating an integrative wellness facility where we go through and actually evaluate every single aspect of the human body. So we look at the neurology, we look at the health of the nervous system, we do the blood work, look at biochemistry, but then alternatively we also look at the muscle-skeletal system. We're checking the health of the different meridian systems. We're asking the questions about mental health and being able to figure out, like, is your issues coming from like the day-to-day stress that's affecting the biochemistry and the nervous system. So data is a huge component of really being able to see what's somebody's biggest voids, and is their neurological issue coming from the neurological standpoint, or is it more of a biochemical, or is it emotional? So data is, hugely important.
Great. And correct me if I'm wrong, Nadine? Mindy is filling in for Michelle, and she is with Dr. Link out of London, correct?
That is correct, but I am an American, just living over there for quite some time. No, I was up here before. I'll give you a little bit of background on Dr. Link, and really we are a data company at the end of the day. But at Dr. Link, we are, I would probably say, on the cutting edge of really delivering patients more convenience by giving and simplifying access to health and well-being. So for us, a large part of what we do is really around the targeting, not quite similar to what you're saying, is actually allowing patients the ability to understand where they need to go within a healthcare system, but also understanding where they're at in their wellness. And both those two data points are enormous in being able to help patients, consumers, people really begin to identify what it is they need to do to change their behaviors, what type of services are available to help support them in that journey, and also support their loved ones. So what we're really starting to see in society is a little bit more of a move to prevention, controlling and managing your own health. And to be able to do that well, we really manage a lot of data and are continuing to look at that. We have over 40 million what we call assessments annually. So it's global and it's big, and it's being able to kind of micro-target down to allowing patients, consumers, a real understanding of their issues and problems, and also what to do about them.
Great. So I'm going to jump into some questions, and feel free to answer feel free to interrupt, and if you have something great to say, and just lead with it. The first question I have is for Alex. What are some of the challenges when it comes to data management at your company?
So just as for some context, we're a group of programs, mostly long-term residential treatment programs for adolescents. And so the vast majority of our teammates are frontline employees, and outside of that, we have mental health professionals, psychiatrists, psychologists, and therapists. And the biggest challenge I've found in my position as a CEO of the company is I'm a firm believer in using data to make decisions. To using evidence and facts and trends and key performance indicators. And we do a lot of work on the outcomes front. From what we know, we've got the most in-depth outcomes-based platform in the country for adolescent behavioral health. And we're collecting data several years out after treatment to see how our interventions worked or not. We also collect data the second a therapy session ends. And these are internationally validated outcomes data that's research has proved they're effective and they work. So there's a few dozen different metrics that we're tracking on an ongoing basis. The challenge isn't to collect the data. The challenge isn't to where to store the data. In fact, for us also, the challenge isn't to analyze the data. We have great visualization software where you can look at trends, you can find specific therapists over time by different genders, if they're better with boys or girls and what ages, or if they're better in the early part of treatment or at the end. We can slice and dice this all the different ways. The biggest challenge is how do you inspire and motivate those frontline employees, that therapist, that clinical director, to care about that data? what we often hear from our team is, not all the time, but every once in a while when we're trying to push more data, is what feels like all we care about are the numbers now. And it's hard because to a certain extent we say, well, everything we are numbers, even though what we do all the time is we're out on the floor, experiential therapy. It doesn't feel like numbers at all. And almost every single one of our teammates, they didn't study science or engineering or math. They had a helping heart. They wanted to give back. They wanted to be in relationships with humans. And for them, data is the opposite of that. So data ends up becoming a 4-letter word in our organization, and finding a way to inspire and motivate people to want to set goals, to reach those goals. For example, when we start to collect data right after a therapy session, we start to see some trends that are proving that a certain therapist isn't as effective. We almost always get pushback that test just doesn't give us the full picture, because this is about a relationship. You don't understand. This is about a relationship, and therapy is a process, and this survey does not, and this test does not speak to that at all. And so the accountability part of data becomes tough, and the cultural part of data and having people be motivated to focus on it to drive results is a challenge for us. So again, that's our biggest challenge, is to align the organization around using data to make better decisions and improve treatment and outcomes. Not the collecting, not the analyzing, not the trending, not the where do we store it. There's probably too much of that. The hardest part is the people part of influencing and motivating teammates.
Excellent. Michael, what are your experiences with challenges with data management?
So being consumer focused, we see, consumers are looking for information to help them understand their health condition, as well as, let's take diabetes for example. When you think about the number of people affected by diabetes, it's staggering. It's probably a third of the country is affected by diabetes. 29 million people have diabetes, 85 million people have prediabetes, and it's rising. So, and most of those cases are type 2 as opposed to type 1. Type 2 is really behavioral-oriented, diet, et cetera, and it just gets away from you. That's going to be a huge burden on the healthcare system and affect quality of life. So, and there's 7 companies that are marketing diabetes drugs to help people. So on one hand, people don't, and all the content out there is generally free from us, from WebMD, from others, and it's ad-supported. People actually don't mind advertising if it's contextual. That's all the research says, is they don't mind it. So on one hand, the data about the consumer that they provide either through their behavior or opting in helps people get ads that are more targeted to them. The contradiction or the conflict is that privacy is affected. We're in this collision course between the information that people want and the data that companies like Facebook and others have on them. And now Facebook's introducing a cryptocurrency system. It's amazing. So what we try to do is use the content as an opt-in in coordination with the data. So we'll have a video and it might say 5 great recipes for your psoriasis. If you click on the link, you've sort of opted in to say, I'm interested in that. Or, great strategies or information for palliative care. So it's a little bit more opt-in. Now we know once that person clicks that they probably have that condition or they're right in that funnel, so we try to serve contextual advertising. But I think data's on a collision course in many different ways. It's so useful, so helpful, but can be also invasive, and that's the challenge.
Thank you. How about Dr. Nick? Do you have any
I have
insight?
lots of challenges with data, especially more when it comes to client care and results. I mean, data for running a business, it's running a business. Like the accountant said yesterday, we have to look at all the information to be able to see, are we making profits? Are we losing money on what we're doing? Looking at that's more specific, and there's good, I would say, actual programs out there to look at that data. But looking at data, it's just information. And when it comes to helping a client get better, it's really about looking at balanced information. And what we found working in a clinical experience is it really goes two routes. One is the data that's coming in from all of the trials that really have no backing in clinic. And there's a lot of great data out there that shows that, you know, this medication's great for this, or this herb's great for that, or these neurology exercises is going to benefit, you know, this disease. But when you transfer that over into clinic, that data can change. So part of it's being able to communicate and have a balance between all of the research data and clinic data, and being able to have more on a global aspect of what's the outcomes that actually works for which types of patients. And then taking that a step further is really be able to help somebody heal through figuring out what's their biggest void, what's actually creating the symptoms, because symptoms are really just a description of, you know, or sorry, a diagnosis is just a description of their symptoms. So it's be able to go through and evaluate all of the different areas of the body, like it's talking about the neurology, the biochemistry, even looking at health of different meridians, and being able to say, you know what, your brain and nervous system is doing really well, and it could be that your gallbladder meridian that goes right across the temples could be causing your headaches. So it's really be able to have a balanced sheet of data to be able to look at, to be able to make the most accurate decision to be able to help a patient sustainably, and not just, you know, cover up some symptoms short term, but we never really got to the root cause, and then the symptoms are going to come back eventually anyways.
I have a question maybe for Dr. Nick. Wouldn't electronic health records solve a ton of these problems? Because it's still so manual. You go to the doctor, why do you still have to fill out a form? Why don't you just put your thumb down and have a biometric that would tell you your profile, or at least some sort of a ID card? The time that's wasted, plus you know, your various doctors should know how you're being treated or what other medications you're being received. And you see this in this premium concierge service, it seems more and more, as you have a high net worth individual pays for one doctor to sort of manage their health and well-being across. Well, I'm going to see the neurologist for my migraines, I'm seeing the dermatologist for my skin issues, I'm seeing different doctors. But wouldn't it be nice, speaking of data, probably the most valuable data that's really still so antiquated, if everyone could see what you're going through, at least your medical professionals that you authorized. It seems all the data we're collecting is almost secretive. It's almost like black ops in terms of the data that's collected, whether it's on consumer sites or others. And the real healthcare professionals should have that at their fingertips and not have to ask you, so when was your last checkup? Or because people are, one of the things we see all the time in our research is people are very nervous when they go to a doctor's appointment. You almost need a second person to go with you. You forget to ask the questions. Doctors are rushing. Someone quoted 10 minutes. Our physicians say it's less than 10 minutes. And they're triple booking patients. So it's like speed dating with your physician, which is terrible. So that electronic medical record seems to be the data component that people don't talk about enough.
That's a big portion of it, is that, you know, I don't know all the information from a different physician that somebody went to, but what I see is, even if we did have those things, our industry is so specialized that they wouldn't honestly know what the hell I'm even doing compared to somebody else, because that's not my wheelhouse. So it's like you have this information, you can glance over it and be like, okay, great, it's not connected, because everything I know from the neurology side of things, it's a neurology problem. Like there's not too big of a connection that, yeah, 95% of your serotonin, your feel-good neurotransmitters, actually produced and made and upregulated in your stomach. So if you have a stomach issue, you know, you being happy or sad has nothing to do with that. So there's a big disconnect of just understanding the data and the medical professions as well.
And Mindy, do you have anything to add?
Yes, no, I do.
Thank you.
I think I'll be really blunt and say healthcare does data management very poorly. And there's massive issues around interoperability to allow data to move from place to place. It's not a US thing, it's a global thing. And one thing I can say, I spend a lot of time in the UK with the NHS, and that is a public sector organization where they're actually looking at how do they take their data to, you know, you do more with it, along with pharma, and saying, actually, this is a valuable data set that we're not doing a lot with. What I would say is a lot of the data, again, is not very good data. Private companies operating into, payers or providers generally do a better job. But I think one of the things that we are constantly looking at is healthcare professionals need help. And the biggest amount of data isn't just the bits, it's actually how do you take data and create insights, meaningful insights. And I think that's the area that we're looking at, both to how do we create meaningful insights to people, patients, so that they really can make meaningful decisions around their wellness and where they go, but also more importantly, where do you take those insights back into the organization to say, on a peerage of your group or against your providers, what are you doing better? Why is there such variation? Because there's massive variation in healthcare. There's massive variation within primary care. There's massive variation in drug delivery. There's massive variation in surgeries. So it really is beginning to deliver back those insights. And once you have some of those insights, you can see real change. And I think healthcare hasn't done that particularly very well. And I think it's crying out for how do we improve ourselves and use data to do that, not just data in and of itself.
Dr. Nick, what are some of the best practices you follow when dealing with data management?
Well, as you mentioned, electronic medical records is, you have to use those for a lot of different purposes. That's, number one. The aspect and challenge out of that, especially in our business, when you're trying to integrate all of that information, no one's created that. And unfortunately, I'm pretty stupid when it comes to computers, so I can't create that myself. Maybe I'll make some friends here that can help create that. But that's the biggest challenge that I have. But the best part of that is having all that information to be able to look at. Unfortunately, they're in all different places right now, and none of that information can communicate together. It all has to be done by one practitioner. And that's not an easy thing to accomplish because you have to be trained in all those different aspects of healthcare. What I see taking that best practice going into the future is having some type of machine learning, deep thinking that can incorporate all that information, having an algorithm to see these are the biggest voids, these are all the connections that's causing stress on the system, that's allowing them to experience their symptoms, and also the opportunities that can be best kind of prescribed or pulled out of that information to allow them to heal. But right now, a lot of that is done through different systems, different softwares, and a lot of it put back onto the physician that's able to decipher all of that.
Michael, would you share a little bit more? You hit on this topic a little bit previously.
Sure. Maybe I don't want to keep coming back to electronic medical records, but there's a tie-in with where I think the doctor-patient relationship is going, which is in telemedicine or remote care. If you live in a big city, it's relatively easy to get a doctor's appointment. If you're far from a doctor, you might be 25 miles from your doctor, people are not going to drive to the doctor's office. They're just going to go into their living room or family room and sit in front of their television. The doctor's going to have a camera and might have some of your biometrics from your watch or whatever device. It's happening. If you talk to the big platform companies, or even the big telecommunications or cable companies like Comcast, they want it to go in the next 2 to 3 years. So I think you'll start to see that. I mean, you've got FaceTime type apps out there right now to make it easier for physicians to see patients. So they're going to have to manage that data in front of them. And there's all sorts of products. There's a company called iHealth at the Consumer Electronics Show. They have a whole slew of products to help, in some ways, caregivers work with their parents' generation. I was talking to one of the guys who, on a regular basis, has got his parents' glucose monitor data that he sees back, and they can be on the phone and they're looking at. So, these caregivers are also acting as sort of pseudo healthcare professionals, and they're having to manage that data. It maybe is data with a small d as opposed to big data and big iron, but this information is really valuable. And they say, like, Mom, Dad, your glucose levels are way too low. And I think you're going to see that more and more. So the use of data, like I'm just looking and saying, okay, I've 90 beats per minute. Is that good or bad? Maybe for a panel, I'm a little nervous. But how people manage small data as well as big data.
Thank you, thank you. And Mindy, do you have anything to share about this topic?
Yeah, I mean, we're doing some really interesting stuff, which I think you touched on it. And the data that we're looking at is a lot of what we're doing is around simplifying the path to health and well-being, which an element of that is digital triage. And obviously tying into digital triage is actually what actions that you may want to do, which is whether you see a face-to-face, whether a video consultation is more important, whether you could use web chat, or actually whether you need to go to a different service. And so the data that we're getting out is actually fundamentally looking at both system level and individual level information. And what we're finding of that data is that by benchmarking before we actually go into whether it's a primary care or an A&E or an urgent care center to put our solutions in, and ours are usually in at a system level covering quite a large degree of individual providers. What we're actually seeing when we do that benchmarking is that we're moving the dial about who's going to A&E and why, meaning we're reducing it. More self-care because actually they have better information and understanding. And what this data is then going back against the benchmarks, it's actually saying, actually digital solutions can help, they're not the end of it. And also the way that you're referring internally on a human basis varies hugely, and the cost implications to a system on each individual one of those is very expensive. And once people start to understand that, and understand how a system works, because most people understand how an individual practice may work, but they don't understand how a system works, you start to change behaviors. And when you start to do that and use data, you're really looking at financial implications and costs, which is a big driver.
One thing to add on the behavioral health topic, which is a massive topic, is people are more comfortable sharing information about their mental health condition, especially millennials, than other population segments. And there's a couple businesses that people are actually completing questionnaires inside their corporations, inside their company portals to say, I've got depression or I've got other, before people would hide that for years and years. And now it's almost expected that companies will help their employees deal with these issues. And I think, let's face it, we're an anxiety-laden population now, not just here in the US, but all over the world. So interestingly, that's a sort of push-pull between the data can be so helpful, but it can be so sensitive about sharing, what kind of condition you have. Think of HIV, for example. There's huge regulations about whether you can remarket or target HIV patients once you found out they have HIV through various choices that they make online in terms of selecting information and so forth. So it is this massive tension that's out there with the data. It can unlock so much potential, but you're buttressing against different privacy concerns as well.
You can keep the microphone, Michael. I have another question for you. What are the benefits you have experienced with data management? Some of the positive things.
Yeah. Well, I think it's targeting and allowing to provide information to people who have a certain health condition, because we focus on consumers and healthcare professionals. So we're providing content around diabetes for endocrinologists. We're providing heart healthy content for cardiologists. So we can take, I'd say, small d for data and find out who those cardiologists are, working with our partners to figure that out. And we do use platforms like Facebook, which has 2 billion users, to put our content out there in headlines and draw people back. So we're using data, but we're probably using content more than data at this point. And then now, the advertisers and a lot of the companies that pay for the entire industry, think of the pharmaceutical companies who are generating massive amounts of money around these big therapies like Keytruda, which is a life-saving cancer drug. That's probably a $10 billion plus brand. These are massive. And they're looking at the back end metrics on what people do once they are online, once they access a website like Keytruda.com. So there's a lot of back end performance and metrics analysis around what's working and what's not working.
Alex, would you share with us some of your experiences with data management and the benefits?
Yeah, sure. So we, in our programs, we believe that to have great outcomes, you need a strong treatment team. Treatment team would be comprised of either the nurse or the medical doctor, the psychiatrist, and the primary therapist, the adventure therapist. There's a number of people who are involved in the treatment of this particular child. And the way we expect our programs to run their treatment teams is that at least half of the treatment team is spent speaking about data, which is very unique for the mental health industry. And when you're doing treatment, typically it's a lot of conversation, not a lot of numbers. So we require them to go through that data and use that data. And for example, I had mentioned the test we do right after a therapy session, and we also do depression tests on an ongoing basis. We're also doing tests on the mother and the father and how they're feeling about treatment and their relationship to what's going on. So we can start to see how it all interrelates. For us, treatment, what's critical about successful treatment is to see the family system as what needs to be healed and addressed. So we need to collect data in all of those different aspects of treatment. And then the treatment team is when we come with all of those reports, all of those trends, all those comparisons to peers, and speak about that, and then come up with specific actions and interventions, draft or revise the treatment plan. And then the next treatment team meeting, we look at the data and we want to see the trends going in a positive direction. If not, we then change the treatment plan again. So it's a very objective process, which is unique in the mental health field, but is, we believe, the right way to do things, in a great way that we're using data.
Thank you. Thank you. I have been given a warning. Our session is coming to an end. So I would like to take some questions from the audience for the panel. We have a couple minutes to do that. Do we have any questions?
Thank you. So when you're trying to be very data-driven and being on the cutting edge of that, there's a lot of pressure to draw meaningful conclusions quickly from that data. So I was curious how you distinguish within your organizations between real causation in data and circumstantial correlation within a certain population that you're dealing with.
You know, for us with data and decisions in general, the most important thing is speed, and we really believe in iteration. It's really hard. We could get into this analysis, paralysis by analysis, and just trying to figure out, is this piece of information or data right? Is this the cause? Was it a coincidence? And we believe that you don't really know, because it's a system and everything is so integrated. So we have to make some sort of judgment fast and do something. So change an intervention, change the treatment plan, and then test it again, and then see it again. And by doing that over and over again, that iterative process eventually leads us to understanding what data is meaningful or not, and what was the driver or not. So we try not to be paralyzed in trying to figure out if it's valid or not.
I'll comment around that too, because in some ways, you know, and I've heard this before, I like to speak honestly, is that with data you can almost tell any story. It depends on what story you want to tell. But I think when we look at it, it's very important to say, what have we created as a benchmark, and how do we look against that? So you're comparing like for like. I also think we have numerous data scientists, but we never forget that whatever they come out with, how do you validate that against the knowledge of the clinician? So it's not looking at things in isolation. We do too much of that. We do too much silo decision making, or only looking at it through one lens. So a large degree, I think, of data management, and it clearly depends on what you're trying to do and what you're trying to manage, is the context. And when you are in a health profession, looking at data is important from perhaps business efficiency, but when you're starting to look at the impact on a health system, you need to have experts also in around you, so it's not unidimensional. I think that's a very, very important aspect to actually getting a true meaning and a true picture.
Thank you.
Can I add to that?
Yes, of course.
Awesome. So like you said, utilizing data to connect a story with that relationship with the patient, the person, the client, is foremost one of the most important aspects, because then they first and foremost, they gain their trust. They know that you know what the hell you're talking about, that you can help them. So that's about being able to take all of their symptoms, take all of the data, be able to match it, and this is why the causations led to these symptoms. So that's first and foremost. The second, what I think is probably honestly the most important part of the data, is figuring out where to start with someone. Because once you have that data, you can find that, yeah, every single system is stressed. We need the challenges in life to be able to grow and to evolve. But if one system's kind of over that stress point, and then it's affecting another system, which system do you start actually helping support to be able to take them in their progression and not backwards? Because it's one of our favorite sayings that we say every single day is, it's not what you do, it's how you do it. Because you can do something beneficial for somebody, but if you do it at the wrong time, you can actually take steps backwards in the healing process. So I think the biggest and foremost important aspect of looking at the data to help someone is where they need to start their healing journey and then where to go from there.
Maybe my last point on data would be looking at the context of the entire market. You know, there's 100 million people that are accessing health information every month in the US. So almost a third of the population, probably half of the adult population, that starts a Google search, migraines, or I've sunburn, or I think I've got some massive condition, and then they start from there. So part of what we're trying to do is look at in the context, if there's 100 million people accessing health information, how many of them are coming to our site or to some of our platforms? So looking at that in the context of the entire market as well.
Thank you. Thank you. Well, I hope everyone found something useful to them or their organization today. I want to thank the panelists for attending and for sharing their thoughts with us. Thank you.
Okay, thank you, William and team. Truly informative. We'll have one more speaker, guys, and then we're going to go on a short break. So our next guest, I had